Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
A mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Shona Ray, and she's the Program Director of the Addiction Medicine Fellowship Program at UAMS and is an Associate Professor in the Department of Psychiatry and is the Outpatient Director for Women's Mental Health Program. Dr. Ray, thanks for being here.
No problem. Thanks for having me.
So tell us about the Women's Mental Health Program.
So we are a program dedicated to the treatment of mental illnesses in women. Particularly, most of our care is of pregnant and postpartum women or women who are trying to conceive. And we do treat mental illness of all types, including substance use disorders.
And there are different facilities around the state, or is this just central?
So we are located here at the main campus of UAMS in Little Rock. We do have two clinical sites. We're here in the Psychiatry Research Institute building, which is near the main hospital at UAMS, which is where I'm presently located. And then we also see patients at the UAMS Women's Clinic, which is right off of the interstate and University. In July of 2025, we actually will be expanding to Northwest Arkansas, where we will have our first women's mental health psychiatrist, Dr. Erin Jefferson. She will actually start seeing patients up in Fayetteville.
So who can participate in this program? Is it just Arkansans? Does it have to be expectant mothers?
So to get an appointment with us, you do have to either be pregnant or within 6 months to a year postpartum or trying to get pregnant. So say you're someone who is got a history of depression and you're on a medication and you're thinking about becoming pregnant. You want to know what to do with that medication. So those women can get in to see us. And then now, as far as Arkansan, we do accept people from all throughout the state, but we do have a few patients that I've seen from Oklahoma or Missouri or kind of the surrounding states for whatever reason. We're the closest place for them to get care.
Does insurance pay for treatment?
UAMS accepts all insurance, to my knowledge.
And this isn't just opioid focused, right? There are other components as well with mental health and addiction as well.
Mm-hmm. So we do all mental health treatment. So anxiety, depression, your typical mood disorders, as well as the more serious mental illness, such as bipolar disorder and schizophrenia. And then we do have a specialized program where we treat women who have co-occurring disorders as well. And those are substance use disorders, which include drug and alcohol.
And is that typically in regards to drug and alcohol? Is that marijuana, methamphetamines? I mean, what are you typically seeing?
So we see a lot of everything. I will say the women who seek treatment with us and actually who engage in treatment, the majority is opioid use disorder. And that's because there are known medications to help with that. And we do prescribe those medicines. But we also see a lot of patients with methamphetamine use as well as cannabis use. And throughout the pandemic, we've actually seen an increase in alcohol use as well.
And nationally, is this what they're seeing as well, or is this just something in Arkansas?
Yes, nationally, rates of alcohol use have increased throughout the pandemic and have said that and are continuing to increase since the pandemic.
And what do treatment programs look like for this? Does it vary from patient to patient? It's not just a one size fits all?
So each patient does need an individualized treatment approach. And there are a variety of treatment programs for patients with substance use disorders. Some will need inpatient care, and that can include either medical stabilization or the more common phrase is detox. We like medical stabilization. It's less stigmatizing. And then after that, they can either go to a long term inpatient unit, which is usually about 30 days. But there's also some intensive outpatient programs, or there are just outpatient programs, or some people don't even need the formalized medical treatment and they can engage in things like 12-step programs, such as, like, most people are familiar with AA.
And you can participate postpartum as well. You don't have to be expecting.
Yeah. Yes. So in that specific program that we have, where we treat co-occurring drug and alcohol substance use problems, those patients actually are allowed to stay with us for up to 2 years postpartum.
And there's medication assistance as well. What does that mean?
So there are medications that can help patients with opioid use disorder, as well as alcohol use disorder, as well as tobacco use disorder. So we do have medications that we utilize during pregnancy for all of those conditions. But more importantly, and what we find a lot is patients with substance use disorders, whether it's alcohol or drugs, they almost always have a co-occurring mental health issue. So depression, anxiety, or a trauma condition, such as PTSD. And we offer medication management for that if it's warranted.
And what is the risk to a baby for medications like that? Will they go into withdrawal?
So it varies based on the medication. The most common one that people are most familiar with is medications that we use for opioid use disorder, and those are buprenorphine and methadone. And those medications are associated with the risk of a baby having neonatal opioid withdrawal syndrome.
And there are some laws in Arkansas that are really catered towards mothers. What does that law look like? How does that affect your patients? Do you see some hesitancy for mothers to be a part of the program or seek out treatment because of the law?
Absolutely. So the law is commonly known as Garrett's Law, and it states that at delivery, if mom or baby has any illicit substance in their system, that DHS needs to be contacted and they must do an investigation. And women are aware of this, and that is a lot of times why they're hesitant to disclose their substance use or to even seek treatment. I have had numerous patients come and see me to get treatment before they've even had obstetrical care.
So how do you screen someone? Is it a typical urine screening? But is that not the usual way?
So we recommend, and the American College of Obstetrics and Gynecology recommend, to use verbal screening. So just asking the patient and saying, hey, I'd like to ask you questions about drug and alcohol use. We ask these of every pregnant mother, and you can use many verbal screenings. There are a few that are recommended for use in pregnancy. One is the 5 Ps, which, and for that one, you ask about present, past use, as well as partner use, as well as family and friends, peer use. I'm blanking on the last P. Pregnancy. Have you used in pregnancy? So those are the 5 Ps: pregnancy, past, partner, peer, and present.
Got it. Data tracking is important as well for the state. Does your clinic and research and support that data to where we know what stats look like for Arkansas and opioid use within expectant mothers?
So we do track some data in our program, but of course we don't capture everyone in the state. We're a very rural state. Many people can't get here. Transportation is a large barrier for people to seek treatment here. So we do track numbers for our own program, and we have published some research study. But one way that it is tracked what is the rate of opioid use during pregnancy is they do track national rates of neonatal opioid withdrawal syndrome. So they track how many infants are born and have symptoms of neonatal opioid withdrawal syndrome. But that still does not mirror the actual large picture, because not everybody who uses opioids in pregnancy has a baby with neonatal opioid withdrawal syndrome.
And prescribing rates of opioids in Arkansas plays a role in this. Where does Arkansas fall?
So we are at the top of the list for the most opioid prescriptions in the nation. We are within the top 3. We have improved since the beginning of the national opioid epidemic, but we still remain about twice the national average, and we still are within the top 3 states of prescribing for opioids.
So you see treatment is so important, but there is stigma that come with that. Is there an embarrassment factor? I mean, what is the hesitancy part of this that you see that when women are afraid to come and get treatment?
Yeah. Well, some of it is just stigma from the medical community. They've been treated poorly. They've been treated, negatively. There's a fear of also admitting, like, I'm pregnant. And, even among people who use substances, when you are pregnant, they even judge you, like, how can you continue to use in pregnancy? I will never forget one of my patients. I asked her, like, how'd you find out about us? And she said, well, my drug dealer sent me to you once I found out I was pregnant. So there's a stigma all around, and there's a lot of guilt as well. These women who get treatment and who seek treatment, they don't want to harm their babies. They want to be good mothers. They want to do the right thing, and they feel really bad, one, about not being able to stop using, and then 2, what are they doing to their baby? So there is a lot of stigma, and, and also when you have a baby, there are multiple people you interact. During your pregnancy, it's your OB. Then during labor and delivery, there's the OB doctors. If you have surgery, a surgical delivery, there's anesthesia, numerous nurses, social work, and then the pediatricians. So there's numerous places where stigma can incur.
And what are the resources out there? Before we close, tell us, what do you want the general public and even primary care physicians, OBs to know? What's out there to help?
Yeah. So one, I think the first thing is ask these women. We cannot find out or even start that conversation with them unless we ask and we screen. And they may not be open to you initially, but eventually throughout their pregnancy, they may start to open up if they feel that they can, trust you and feel non-judged and non-stigmatized. So that's the first thing I want to know or want people to know. And then the second thing is, if someone there are places to help. We're here in Central Arkansas, so feel free to give me a call or reach out to the Women's Mental Health Program here at UAMS. Or the other thing is, there are also facilities throughout the state. There are specialized women's services throughout the state. There's 4: Lake Point, Harbor House, Gateway, and Arkansas Cares. And specialized women's services are inpatient substance abuse rehabs for women, and specifically women with children or who are expecting. And these facilities provide multiple services for women, including they let the children be housed with them at the treatment facility. So the women do not have to be separated from their children. And they provide them, kind of all around services. And so that's a really good resource, and they are more than willing. There's plenty, they will find you a bed if you have a woman who needs help.
Well, Dr. Ray, thank you so much for talking about this important topic, and thank you for the work that you do for Arkansans.
Well, thank you. And please, just if anyone out there needs help, send me a message, an email, call me, text me, and I'm willing to help.
Thank you so much.
Thank you.
And that's it for this episode of AFMC TV. Thanks for watching, and have a great day.